All right. Good morning.
Good morning.
Good evening. We're doing,
Yeah.
It's morning today.
Yeah.
I think it's the first time we've done this in the morning. We're pre-recording this one.
Yeah. We'll see how clear our brains are in the morning.
Yeah. We got enough sleep. Follow our own advice. Hey, this is Healthier Ever After. I'm Rick Sorensen.
Greg Camp.
We are here talking about healthy lifestyle, weight loss, and all kinds of things. We wanted to get in a little bit. Last time we talked a little bit about the testosterone. What are we going to call it? An epidemic?
Yeah.
Just how overall testosterone levels on average have been declining for a couple of decades at least. And you know, we got a little bit into the causes. We can kind of just review that a little bit. And then what we want to do today is get into what do we do about that now? Right. And why do we care? What do we do? Is it something we have to fix? How to do that?
I think it's important to point out. So this episode is obviously we're going to be based on the last episode. We're going to be talking about male testosterone. Now, female testosterone, very much is important, changing all the time. Now, we're going to get into that on a later episode where someone that would be viewing this would be where it benefit a female to watch this is you probably have a male somehow, some way in your life. So if you're curious about it, if, I don't know, you feel like your husband's been dragging and, you know, you're kind of been wondering about his levels. A lot of times where I see guys in clinic is actually because their wife drug them in by the ear and they're like, hey, look, he's dragging, he doesn't feel good and he won't do anything about it. So then the wife drags him in, we find out their testosterone levels are low, and then we work on a plan in order to help that. We're going to talk about kind of what we see, what the science says behind this. We talked a little bit about that before. And then now this episode is kind of going to get to the, what do we do about it?
What do we do about it for male testosterone levels? Yeah. I'm super excited. You mentioned that we're going to be going into our transition next week or soon is probably multiple episodes on female hormone.
Yeah. Big one.
Yeah. Not just testosterone. They have like other stuff.
I mean, both systems are complex.
Very.
The female system is obviously even that much more complex. So, you know, we're hoping to have a guest on that specializes in female hormones she's
passionate. She's passionate.
She's excellent, and she can really dive into this probably better than me and Rick ever could think about. But you know, we'll get into the male side of it today, and with hopes of getting into the female side of hormones soon. And testosterone is a big part of that on the female side. I think sex hormones in general, we associate estrogen with females and testosterone with males, but no, both of us need a certain amount of each. And we'll talk about the male side and of course get into the female side later.
Well, and I think today's topic, talking about testosterone, we're going to get into some therapies and strategies to increase that. And I think even more today, it's important to remember that this is informational and educational purposes only.
Yeah.
We strongly recommend that before beginning any replacement therapy, medication, exercise regimen, diet, or other program that you speak with your licensed medical provider who can then give you direction and work with you on that.
Yeah, this is like a lot of areas in medicine, and with the availability of online stuff, I mean, people can kind of get into this on their own. You know, you can find ways around working with a medical provider. The problem is, and I do see it in clinic when you know, guys typically are like, hey, look, I've been going at it on my own and things are not quite right. I felt really good in the beginning. Now I'm not feeling so good. A lot of it is just because, you know, you only have half the puzzle. And so find a good medical provider if you want to dive into this more that works with hormones and does this. Is, you know, it's not all providers are created equal when it comes to working with hormones. So find a good one. We'll
hopefully our discussion today and upcoming episodes can serve as kind of a basis or some groundwork to just help you know how to have that conversation. What do you need to talk about? What questions to ask your provider?
Couldn't agree more.
So
yeah,
with that, let's get into it. So just a little review. Last time we talked about the epidemic. I made a couple notes we talked about root causes, why testosterone is declining.
Yeah.
A lot of it has to do with just our lifestyle, obesity and a high BMI change. It's not just changed by testosterone, but it affects how your body regulates and generates testosterone and other hormones, sleep. We've talked about a whole episode about sleep. We probably hit that again sometime.
Yeah.
But poor sleep is a strong cause of or correlated with low testosterone. And so you had talked about like night shift workers, just
almost every shift
low.
worker, night shift human being that comes into my clinic and gets their levels checked are notoriously on the either low end of normal when it comes to their testosterone levels. And so there definitely, at least anecdotally for me, has been a correlation there.
Yeah. And other things, just mentioned sedentary lifestyle, chronic stress. We talked about these other things, tobacco use, carbonated soda, decreases testosterone, and excessive alcohol. So those are kind of some lifestyle and metabolic causes. We also mentioned a little bit about environmental toxins and things, the microplastics and fragrances, food packaging, pesticides, sodium fluoride in water supplies, low vitamin B, vitamin B12 specifically. So those are other things that we can address.
I think
that's kind of how we get it low. Those are things that
I think even to hit on that, you're naming a lot of these things, and I kind of would argue that there's probably, if someone is dealing with low testosterone, you could probably pick, out of those 12, 15 things that were mentioned, you could probably find most people have. I don't think it's just one of these things. Sure, we know sleep. We talked about this actually before we started talking on this today, is that sleep is just one of those big factors. But I would argue that most people could pick 5 of these things that they're like, oh yeah, that's a problem. Or so it's probably more of a
little bit of this and a little bit of that than one thing.
Probably not just one thing. You most people could pick out a few of those things where like, oh, either I don't know if that's a problem, or that's definitely a problem. So I think it is this combined effect of just our lifestyles and environment nowadays.
Yeah. Okay. So what do we do about that? Let's talk about first line therapies. If I say, okay, my total testosterone is low, how do I fix it?
Yeah.
Right.
Well, and I think we start at a base level of saying, hey, this is our foundation. You have to have a foundation in this, because you can throw as much medication at a problem as you want. If there's no foundation, especially I found this with dealing with hormones, if you're not putting in any work on your end to try to correct some of these these causation factors, unfortunately what we find is that you're going to get maybe a little bit of benefit, a little bit of relief from symptoms, but unfortunately it's going to be a hard journey, because it just doesn't seem like it's long standing. And so really you need to just start with a foundation. We talked about initially sleep. And so sleep being one of those big things. And if go back through our episodes, find the one on sleep, and we talk about it, how it relates to weight. But I mean, in all of that, right, weight and lack of sleep are going to be a huge factor in.
We could even do another episode on like some specific tricks of the trade for good sleepers.
That's actually a really good idea, because I mean, it's, most people, if you're just a great sleeper and that's never been your issue, fantastic. You're not like, 75%.
Sometimes you got to be actively engaged in getting good sleep.
Yeah, you do. It's a little bit of, especially if someone that doesn't just hit the head hits the pillow and then you fall asleep. There are a lot of techniques and a lot of things that we're doing lifestyle wise that unfortunately disrupt our sleep. And so sleep is one of the bigger factors that do affect this. So look, you need to get your 7 to 9 hours of sleep in general. I mean, some people require a little less, some people require a little bit more, but in generally, you need to be prioritizing sleep. I mean, this is going to be one of your foundational things. So set the phone down an hour before bed and really focus on trying to get some good sleep. And that's going to be one of your biggest foundations. Obviously, we're going to talk about this probably in some way, no matter what topic. Exercise, activity. You got to move. Yeah. There's so many factors that come in, or so many things that are affected by you being active and exercising, and hormones are no different. In order to get your hormones optimized, for your body to optimize your own hormones to the max amount that they will go, I mean, you have to be active. And this is usually a mix of resistance training as well as cardiovascular exercise. Yeah. And, so those two things alone. Now you're talking about nutrition. So you need to make sure you're getting a good variety in your
Can I
diet.
just go back on
Yeah,
exercise?
yeah.
So the studies talk about that. There's actually specific benefits with resistance training, like working your large muscle groups
Oh.
with some resistance training. We've talked about that in relation to GLP-1 use and mitigating the protein or the muscle loss that's quote caused by that.
Yeah.
And really it's caused by not working out those big muscle groups.
Sure.
So resistance training is one, but then actually the studies also talk about high intensity interval training.
Yeah.
And that's one that my daughter has taken me and done some things like that. And it's just, if it's not on a bicycle, I'm not good at it, but
yeah, no. And I think it's just is like, and we can always dive into this, but I really think that some people get hyper focused on, oh, what exactly should I be doing?
Yeah.
Actually, most of the studies show that it's whatever you like doing.
Moving.
Like find some combination of something that you enjoy doing and make that work for you. I mean, in Rick's case, he loves riding a bike. So, I mean, he doesn't ride on flat ground, right? He'll go mountain biking and things like that. I mean, if you think riding a bike is easy.
He says, I'm nursing broken ribs. From 2 weeks ago when I stopped mountain biking very quickly.
Yeah, you should see him. He looks like some of our ER patients that we take care of with he's pretty beat up.
But I got back on the bike this week. And it was great.
Good. Yeah. Avoided falling 15 feet or whatever you fell.
It was only like 8.
Oh, well, yeah. Go fall 8 feet under rocks and you tell me how you feel after. Yeah. And Rick's not a young guy. Okay. So he can't be falling like that anymore. We'll have a broken hip. We willing him in here. No. So
we were being active. We were being active on how you can, what you like to do. I think that's one of the, I mean, that sounds simple, but that's one of the most profound things when you say, find something you like to do. I think more important than how many intervals you do or how much weight, you can bench press and squat, like your resistance training. Far more important is something that keeps you active, that you enjoy or can sustain, because if you hate it, that's just another level of stress.
It's so true.
And I think that's just super important that maybe we brush over sometimes, but finding something that you like to do is, I think, top priority.
So important. Yeah. If your only focus is just, I need to do this because,
if exercise is drudgery.
Yeah. It's just you're not going to stick with it. You're going to find every excuse in the world not to do it. So find something you like, get something that can incorporate some resistance in some way, get your heart rate up. And, I would say the evidence would be overwhelming that you would have some benefit there if you can just stick with it. I mean, you can go high intensity on something you hate for 2 weeks. I don't think that's going to do a whole bunch for you. So no, I think that's a really good point on that. So find something you like to do and get moving. So these are, once again, these are the base, these are the core, these are the foundations of saying, hey, I want to optimize my own hormone levels. Yeah. This is how you do it. Yeah. As far as nutrition goes, obviously just a balanced diet, right? We need to get all our nutrients. We've talked about a real food diet.
It's interesting that all the things we've specifically talked about with weight loss.
Yep.
Are the same things.
Yes.
To kind of normalize, I guess would be the word, normalize your hormone levels. It just makes the whole system work better, and whether that's with the weight loss side or the hormone side, because they're so intertwined together. But it's just interesting, like when we're talking about specifically what helps the testosterone, it's exactly the same stuff.
It is. And it's, so this is really just coming at it from a different angle of like, hey, if weight loss isn't your motivation, I know some people that are actually quite thin, right, that are dealing with, really bad fatigue and all these things that you end up checking their levels and they're quite low as far as the testosterone goes. And so these are things that they need to, even if they're, skinny, what does that even mean? Like some people are just naturally built skinny. They don't work out. They don't eat right. They just tend to, I guess, hit the, genetic lottery when it comes to not being able to pack on the weight. So that doesn't necessarily being thinner, if that's just genetically predisposition for you, doesn't necessarily mean healthier. So, I mean, really, if you want to optimize this stuff, I agree. It's a lot of the same principles. So if weight loss isn't your thing, well, then maybe your motivation is trying to optimize your own hormones.
Yeah.
Nutrition's a big one. Real food diet, we always push that, and that's mostly because the real foods are not typically the ones getting us in trouble. Hopefully, you can find more organic type things that you can avoid some of the other environmental factors. The real foods are the ones that are usually going to be packed with nutrients, right? The things that you need. There's some supplements that are
okay. How about this for a catchphrase? You should eat foods packed with nutrients, not packed with plastic.
Yeah. There's a big thing with that right now. There's not a lot of people arguing about that. There's like, oh, there's something here with these microplastics.
Yeah.
Like, what's going on with this?
Yeah.
And we don't really fully know yet. I think a lot of this is going to come to light, and it'll probably change the whole way that they manufacture food eventually.
Yeah.
But right now, we don't really. Yeah, it's early on. This is like we've kind of known, but this is definitely being a new topic that they've dived into, and it's going to be, I think, a kind of a big deal coming on to, because it's going to really change the way that they manufacture and process food.
Yeah, well, and talking about nutrition, it's important to talk. Some of the like the micronutrients, the vitamins, I guess, vitamin D, zinc, B12.
Vitamin D is a huge one. Key.
Yeah.
I mean, hormonally, vitamin D acts more like a hormone in the body than it does a vitamin. Fat soluble vitamin, very important, especially when you're getting evaluated for your hormones. If your medical provider is well versed in hormones, they probably will end up checking a vitamin D. But if they're not, they may kind of brush over that one. Ask specifically, are you checking a vitamin D level? It's very important. Zinc is a big one that's tied into helping with hormone optimization, especially related to male testosterone. That's been a big one for a while. Another big one that is kind of been more popular recently is boron. So boron is one that doesn't raise your total testosterone. What it does is unbind some of your testosterone. So, and we can dive into kind of what this all means. I guess this is the episode maybe to do it, but you have a total testosterone, and then you have a free testosterone, which is like what's actually available for your body to use. So just because your testosterone's, if it's 800, it doesn't mean that you get 800 to use.
So would that mean, I guess trying to think a quick analogy on that would be like your total testosterone, it would be like gas in the tank, and your free testosterone is how many injectors you're using to run your engine.
Yeah, yes. Yeah, because you could have, all the fuel in the world
in the tank, and if you can't get it to the engine,
then it doesn't matter.
It doesn't matter.
So it is really just what is remaining once your body, because your body has what's called sex hormone binding globulin, and it binds up, by design, binds up testosterone and estrogen. It's a sex hormone binding globulin, and your body does that to regulate certain things. And unfortunately, what happens with, sometimes you just get too bound up. Sometimes it can be lack of activity. Sometimes it can be dieting. In fact, they found that even though fasting can be really helpful for those that kind of, I think, it's not really it's like unintentional fasting. These people that go long periods of times without eating, so that when they do eat, it's not necessarily focused on like, oh, I meant to do that fast and now I'm going to eat really good. They can actually end up having a higher sex hormone binding globulin, which then, so of course they're dragging because they have enough testosterone. They just can't use any of it.
It's a storage thing.
So boron in several studies has been found to help unbind some of that. So it just makes more of your testosterone usable. I'm not telling everyone to go get a boron. This is once again why you need to meet with someone and say, do I even have this issue where I have too much testosterone that's being bound up? But when we're talking about nutrition, boron is one of those supplements that's been found recently to be very helpful in unbinding some of that. So it should just make more available. But once again, work with your medical provider.
So that would be something. That talking about that you could be in a situation where your total testosterone is good. You have a good level, but your body's just not using it because it's not freed up from those binding globulins. It's kind of sitting there in storage, and we're looking for a way to get that into the active system that you're using. Yeah. Right.
Yep. And so exactly. So you just need to release some of that testosterone. You have it. You just need to unbind it. To try to describe this, it's just, you can't use something that's bound up. It needs to be free. This goes for a lot of things. Testosterone is no different. You cannot use something that's bound up to a protein, it specifically stops it from binding to receptor sites. So the only testosterone that you can use is what's free. And so making sure that you have enough free testosterone to actually use it and feel good is an important factor. And so so supplements, that's a big deal. And then stress. I mean, this is a hard one because it's not easy to just be like, well, I'm just going
to turn that off.
Yeah.
I'm going to turn the stress off.
Yeah. We know that increases cortisol levels. We've talked about that before.
Yeah.
We know that. So it affects your weight. Well, while it's affecting your weight, it's all tied in, right? This can significantly lower what's available testosterone wise. Your body really just doesn't like to be in a sustained state of stress. There's normal to have short amounts of time where you're stressed. It's not normal to stay in this sustained state of stress. So finding different ways, well, heck, it's therapy or once again, activity we know can significantly help with your body managing stress, obviously staying nutritionally sound. If it seems like all of this is tied in and it's repetitive from what we talk about weight loss and just overall wellness, it's because it is.
It is.
Yeah, it is repeat.
Yeah, it is, which is good. It's another application and perhaps maybe motivation to sort of work on doing the things that lead to better health. Really, that's why it's healthier ever after, not skinny, not low BMI, not high testosterone. It's healthier. And all of this does work together. And the end goal is to be lastingly healthy.
Yeah, I would say if you're listening to this and you're like, boy, I would love to do all that, and it's just overwhelming. Kind of think about back to some of the things we've talked about. Pick one thing. It doesn't have to. You don't have to get all this down in a week. Pick one thing that you think you can focus on, and when we're listing off this stuff, and just start working on one thing at a time. And I think in a lot of cases, like we start building this nice base to where the thing that was hard before, you're now doing daily, and now you can start adding additional things in.
Yeah,
it's not. This is not meant to. This is not meant to be something that hey, I'm going to change all this today.
Yeah, and nothing that we talk about is should be thought about as like a quick fix. Hey, I'm going to do this for a couple of weeks and go. Like when we talk about moving more, exercising, supplement, diet, nutrition, whole real foods. All of those things that our time frame is forever. Like for short-term goals, like let's, when we talk about weight loss, I have a goal weight, right? I want to get that goal weight. I want to lose 50 pounds. We're not talking like a few months, usually on the onset of something like that with a defined goal. We're talking about, let's plan for 2 years, 3 years. And that's the time frame just to kind of reach this desired goal. And a lot of times it happens quicker, but certainly not like less than 10 months, a year. But that's the time frame we're talking about. This isn't like a few weeks thing. And all of this goes together like that kind of expand your time frame. So do one thing, like you were saying, and do that well for a few months. And then as that becomes kind of the normal, you can add another little thing, because this really is a lifetime lifestyle adjustment that we're working on making. And so there's not really an end point other than you feel better during the last 20, 30 years of your life.
Yeah. And you just kind of remind, it seems like just kind of thinking about that and working with a lot of patients that we talk about a lot of lifestyle stuff. It seems like good behavior or healthy behavior, if you want to like stay away from good versus bad, it's not like evil. Healthy behavior feeds into healthy behavior. Right. I find that a lot of people that start doing one or two things and can get over that hurdle, it seems so much easier for them to start adopting these other lifestyle behaviors.
Yeah.
So it's not like it's not like
the incremental change to then add on one thing is less.
Yeah. And I'm sure there's some awesome science behind that. I don't know what it is, but it's just observing this. It seems like people that are able to change a few little things and take that initiative, it seems like the other things come a lot easier.
Yeah.
So I think take that into account.
Funny, it just comes to mind the old story about the British cycling team. I don't know when this was. We'll have to do some research, but they were like horrible, last in the world, and they got a new trainer, and he talked about like we want to make sure our chains are clean, or the air pressure in our tires is just right, or what tiny little changes that make almost no difference.
Yeah.
And his whole point was, like, he talked about the combined or the cumulative effects of small incremental changes.
Yeah.
And so if keeping your chain clean increases yours by 1%, and then do another thing that's 1%, like over time, the cumulative effects, and they became like world-class champion race team by adopting that strategy. And I think a lot of that has to do with what we do here. We talk about small incremental changes, and what we're working on is the cumulative effect of that.
Yeah.
As you make small changes, multiple small changes, add another little small change, but in time, the cumulative effect of that is much greater than any of those individual things.
I agree, and I think a lot of it is for some people it is an all or none. I think sometimes we can get distracted by, well, if I had these goals and I was doing pretty well at, who cares, exercising, sleeping better, all that. You were working on something, and then we go on vacation, or we have something that throws it out of whack a little bit. I think sometimes those can be the times where we are like, oh, well, I messed it up. I promise you did not mess it up. If you had a 3-day stint where you went to Vegas and you had a great time and you didn't sleep well and all stuff because you were just having fun and you were, you're getting into a little bit of trouble, you didn't mess it up. Like what you did is you went and you probably took some much needed downtime to relax and rest, and there's some benefits there. When you get back, it's not like you messed everything up or you're starting back from ground zero. You took a few days away from what your normal habits were. Just erase that from your memory. You had a great time and move on. Sometimes I think all of us do this. I know I've been there before where I felt like, oh, I messed it all up. Like I'm starting back from ground zero.
So did you feel that way when you came back from Costa Rica?
Yeah, I'll tell you what. Yeah,
I'm listening to you like, this is the guy who was just in Costa Rica.
Yeah. You're definitely getting back into it mentally when you get back. You're kind of like, oh, geez, like Costa Rica, it was great. Overate, and
you
did other things. Yeah, we ruined everything. But no, really, I mean, honestly, what it was is that, you go and you enjoy yourself. And I'd argue that short stint of relaxation and enjoying yourself is every bit as important as any of these things together. You got to have those breaks, but don't let it throw you off mentally. You didn't take 3 months of progress and mess it up in 3 days. You couldn't do it if you tried. And so don't get distracted by the times where you're like, hey, look, got a little off track because we went and had a good time. Try to focus in on the fact that you've been 3 months in, you had 3 days, and you're like, hey, it was a good time. Let's move on. And I think mentality wise, and we've talked about, I think that was our second episode, was talking about just have the mentality you have. I think mentality wise, you got to focus in on that. But let's obviously get into how we help with testosterone.
So what we talked about, the exercise, sleep, stress, nutrition, those are all kind of addressing the lifestyle causes, most of that of low testosterone. But what happens when that's not quite enough? Like I'm doing all these things and I go to my doctor and he says, hey, your free testosterone is really just still not quite where it ought to be. Yeah. Like what's the next step?
So a lot of times this is when we talk about medications, and this can be controversial a little bit. And I'll tell you why. I mean, a lot of people just don't agree. Like some people think that everyone just needs to be on testosterone replacement therapy, meaning you're getting some kind of exogenous or external testosterone for your body. That's not always the case. We're going to talk about like kind of the 3 general methods for trying to help with your testosterone medication wise that are available, and why they matter, why it makes a difference. So the first one I would say, starting with, a lot of people don't necessarily, especially if you want to continue to have children, because testosterone and sperm are all kind of made by the same general signals from your brain. And that is, so you have your pituitary gland, which sends a signal to your testicles, which is luteinizing hormone and follicle stimulating hormone. So these are the ones that are responsibility for sending essentially the signal to your testicles in order to be able to create testosterone. Now, we could talk about secondary or primary reasons why testosterone is low. So sometimes that signaling system is just broken.
Mm-hmm.
And so if that's the case, short of a fix for fixing that, then no, you probably just need to replace your testosterone, meaning that you do it exogenously. And like I said, we'll talk about that. I guess there's just a lot of different avenues we could go about this, but let's just say that you're a person that you've had your labs checked by your provider, and yet you're still wanting to remain fertile for whatever, if you're still having children or things like that. Or let's just say that you're not quite ready to commit to shutting down your own testosterone supply. We'll talk about that. And let's say that you'd like to do more of a boost on your own system. The two methods for this that are currently available, short of doing something that's kind of like online, not really guided by a medical provider, are SERMs. So these are estrogen modulators, and that's usually clomiphene or enclomiphene. And these are medications that are prescribed by a medical provider. And these, what they do is they boost the signal from your pituitary gland, which is LH and FSH, and they send that signal, a higher signal, to your testicles in order to increase your testosterone, your total testosterone, which then should increase your free testosterone if you're not binding up too much. And so that's just a more of a, what we would call, I guess, natural way. It's not.
So it's using your own factory to produce the testosterone.
Yep.
It's just sending it's boosting the signal, so that it kind of turns the factory up more than your own body is doing on its own. And
it's all on a feedback loop, and it uses actually estrogen is the one thing that we use to actually like feed that feedback loop. So your body senses estrogen, the pituitary gland sends out a signal based on that. So, if you're, a lot of times we can just bolster that signal, increase your LH and FSH. And then therefore, if your testicles are working the way that they should be, then they will just increase your testosterone. And in turn, if you're using a SERMs, which is, like I said, clomiphene or enclomiphene, you will increase your sperm count. Maybe you care, maybe you don't. But it does happen kind of together. And so that I see 2 to 3 times. So let's say someone comes in at a level of 300, they're having symptoms of hypogonadism or low testosterone. And I've seen patients that will get on these medications. It's usually a daily pill, something that you do daily. I usually see 2 to 3 times a boost. So if they're at 300, I'll see anywhere from 600 to 900 within a few months. Most guys tolerate these medications well. There's very few side effects. Vision changes is the one side effect that very few people have had, like just a little bit of blurry vision. They stop taking the medication, it goes away. There's really just not a lot of side effects that are associated with these, and even the ones that are out there, it's just something we don't see a lot. It's just a very low probability of that. So just don't see a lot. And this boosts your own natural testosterone. If you stop taking them, you should essentially just return to normal. Now, what's normal, right? Like, let's say that you started at 300, you get up to 900 and you're feeling great, but then you decide you want to go and do it on your own, or you just don't want to take those pills anymore. What we found is I've had some people where they've gotten off and we've tested them later, and they are actually at a higher base level than they were when we originally started. Now, think about it. They got up to 900, we're using the SERMs and their own natural testosterone. They started working out. They started sleeping better. They started feeling better. So naturally, their base may end up just being a higher than it was when they got on the serum. So it's kind of nice that way. I can't really say that there's any evidence or study that shows if you do this for a certain amount of time that you're going to increase your own natural base testosterone, what you make naturally. But
it makes sense if you've made those little lifestyle changes as part of having that level increased, that would maintain some of that just by the things we've previously talked about.
Yeah, it's just a lot of times I look at it just like a catalyst. I have a lot of people that get on them and stay on them. They feel good. There's no problem with that. But if someone would want to get off it at some point, a lot of times we would argue that their base may be a little bit higher. So the other way to do this is a little bit different way. It's called HCG. Pregnal is kind of the brand name. It's a luteinizing hormone. So this is an injection that you usually do 2 to 3 times a week. And essentially this bypasses if the theory is, if you have a provider that checks into this and they think, hey, the boys, the testicles are working. We just don't, the boys are working. Is that medical? Can we
Yeah,
say that? Hey,
yeah,
I'm not your medical
yeah,
provider.
we are not your medical provider, so we can say the
we
boys.
can say the boys are working.
Yes.
They just really, you're just wanting to bypass the pituitary gland because that's obviously that's a more complex system, right? You have to
It's
get
just
the
setting up your own signal.
yeah.
Just
So
boom.
so this is basically a way to bypass the pituitary gland and really just send luteinizing hormone directly to the testicles. You do an injection, and what this ends up doing is supposed, specifically helps your body focus in on really just creating more testosterone through those injections. It does it by the same mechanism, meaning that all you're boosting is your luteinizing hormone, which is the one primarily responsible for creating, telling your testicles to create testosterone. And so you do this injection 2 to 3 times a week, depending on what your provider's preference is, and I guess yours. And then, so you're really just doing. HCG is good. It's usually $200 to $225 a bottle that lasts you a couple months. So not the cheapest way to do it. It definitely can be a little bit pricey, but a lot of guys really like that, using the luteinizing hormone. And so it is something to consider. You can talk to your provider about it. I usually see at least a double in their testosterone levels, depending on how high you're going. And so, yeah, talk to your medical provider about that one if that one sounds more appealing to you. And it really just bypasses the whole pituitary gland altogether. And it doesn't stop you from making your own testosterone. It maintains fertility, which is a real big promoter for a lot of guys, especially younger guys that are looking to really just bolster testosterone without decreasing sperm counts.
So then does that bring us to the last?
It does.
Option.
Let's say that all these fail. Let's say that, you're over, you're over 50, you're over 60, and you just feel like, hey, look, the system, they check everything out, and maybe either they don't feel like the system is in a position to be able to help by you trying to boost your own natural testosterone. Maybe you just don't want to do any of that. Maybe you just don't want to try to take an old car and fix it up. Maybe you just want a new car. Maybe you don't want to have to try to, fix up the old car and get it going. And that'll be a discussion between you and your medical provider. The reason why testosterone is a controlled substance is because you become reliant on it. Your body will become reliant on it because you will stop making your own testosterone. So exogenous testosterone or giving yourself testosterone injections stops your.
So this is any testosterone that I'm taking and putting into my body, injection, the gels, the creams, any of that I'm taking testosterone and just putting it into my body, and it's the testosterone that now my body's using. What you're saying is that will ultimately, that feedback loop will send a signal, say, hey, I have enough testosterone, don't make any because I got enough. But the enough you have is what you're putting in, just to be clear.
So you will eventually become reliant on this. If you do this, you will eventually. Now there are people that get off and then start on like a SERMs or an HCG to bolster back their own levels. Let's say that they just, I don't know, they change their mind or something. So people can recover from this, right? You can fire back up that system, but eventually we don't really know. We really have no evidence that says or 5 years or how long you have to be able to fire up the system. So there are people that go off testosterone for whatever reason spontaneously, and all of a sudden, they're going to have to make their own. And I've seen people's levels recover, not usually back to anything what they were. Usually it is quite low. So this is a big commitment. You need to talk to your medical provider and understand what you're doing. It's a great thing. Like if someone benefits from this, maybe they've tried those more conservative methods and it just wasn't working for them. I mean, testosterone therapy can be a fantastic thing. It can help with so many things: bone strength, heart health. I mean, obviously keeping a good amount of muscle. I mean, there's so many benefits to having a good testosterone level, mood, energy, you name it. But this is doing it exogenously through shots or the creams, and can be really helpful. I've had a lot of men that come in and they get on these on testosterone, and we feel like that's the best method for them. And boy, I watch it change their lives. In fact, I've watched a lot of guys come in and they think they're really depressed. They're even on antidepressants. They get on testosterone, and all of a sudden we're taking them off their antidepressants, and they're feeling so much better. Their issue was never really primary depression anyways. It was actually just low testosterone. So I'm not saying that's always the case, but I'm saying that I've seen many cases where really they were just kind of attacking the wrong thing.
Yeah. So summarize then, get with your medical provider, get some labs checked. Based on that, work on some lifestyle changes. And then reassess in 3 to 6 months time frame. Yeah.
Usually just reassess at that time. And initially, sometimes the labs are more frequent, and then they'll, usually extend them out as once you optimize your testosterone levels, you're feeling good. What I will say though, is that doing testosterone therapy, no matter how you're increasing it as far as medications go, does not replace the foundation. If you are not doing those foundational things, I can tell you, it doesn't matter how high you get your testosterone levels, you are not going to feel better. So yeah, maybe you need that little bit of help to get motivated to go to the gym because you're just dragging. So maybe initially getting your testosterone levels will help with that. But if you don't take the initiative to do some of those things, I've seen it time and time again that guys will feel good for a little while and then they go back down to where they're just not feeling that great. You need to be active and moving. You got to eat decent. You know, you got to do those things. Otherwise, you're just taking something that, frankly, any medication will have some risk. You're taking something for a little bit of benefit for much higher risks. I just don't think it's worth. I just don't think it's worth it if you're not going to put in some effort, some work.
Yeah. No, perfect. And then you reassess 3 to 6 months, and if you need, there are other options to then boost your own system or replace exogenously. So So anyway, that's our testosterone rundown.
Yeah, that's a lot of information
about it.
Yeah,
right?
it's really just the information to get you to the point where you ask the right questions when you go see a medical provider or you drag your husband in to do it.
I was like, ladies, if you're listening to this, this is so you can fix your man.
Yep. So yeah, that honeydew list isn't going to get any shorter. So, you know, you got to get him in there, get it going.
How to shorten your honeydew list. That's
not motivation. I don't know what it is.
Yeah. Well, okay. We appreciate it. Again, talk to your medical provider. That's especially on this stuff. It's a key thing. We are here for educational and informational purposes only. But really our goal is that you can make some of these changes and live healthier ever after.
Yeah.
So with that,